Why does your weight increase? That's because your body retains water. I checked other channels too, but some of them had mistakes. When your liver is the cause of water retention in your body, it's more common for fluid to accumulate in your abdomen, called ascites, rather than swelling in your legs. So, hello, thank you for watching the video. Everyone, do you know the signs that appear when your liver is severely damaged? Actually, the liver is called the silent organ. Even when symptoms do appear, they are often unexpected, so it's not uncommon for people to overlook them and end up in serious trouble. Symptoms like these in your hands or these in your mouth might be signs from your liver. I'll introduce them now. Most of the symptoms occur as fatty liver disease progresses. Do you know the percentage of Japanese people with fatty liver? It's said that about 1 in 3 people have fatty liver. Even if a doctor tells you during a health checkup that you have fatty liver, many people just think they're a little overweight and don't take it seriously. But if you leave fatty liver untreated, it can progress to a condition called cirrhosis, and once that happens, it can't be reversed. Cirrhosis means your liver has become hard and stiff. When you repeatedly damage your skin, it forms scabs and hardens. Similarly, your liver gradually hardens when repeatedly damaged, leading to cirrhosis. Cirrhosis dramatically increases the risk of liver cancer, a leading cause of death among Japanese people. If you can notice the early signs of liver problems that I'll introduce today, your chances of living a long and healthy life will increase. So please listen until the end. Even if you think, I don't drink alcohol so I'm fine, or I'm not overweight so my liver should be okay. Many people are surprised to find that their fatty liver has progressed and that they actually have some of the symptoms I'll be talking about. The symptoms I'll mention later are especially important, so please make sure to watch until the end. When your liver starts to get worse and you go to see a doctor, in many cases, doctors may prescribe many medications, but no medicine can actually restore liver function. This is due to the structure of hospitals. Tests, diagnosis, and prescribed medication are medical fees. However, when hospitals provide information about disease prevention or early symptoms, they don't benefit financially. However, I believe the most important thing is what's called pre-disease, catching potential illnesses early and preventing them before they happen. That's what I think. This time, I usually provide outpatient care for the liver. From the perspective of an active physician, I will clearly explain knowledge about disease prevention and dangerous symptoms. So, let's get started. Here are 7 dangerous signs that appear when your liver is in bad condition. The first one is redness of the hands. Seeing is believing. Please take a look at this image. The redness of this palm indicates that the liver is in bad condition. It might be a sign. A man in his 70s visited my clinic saying, "Doctor, since I started working in the fields recently, my hands have turned red. Could you take a look?" He showed me his hands, which I examined. In that moment, I thought it might be caused by his liver. That thought crossed my mind. So I decided to run some tests, and it turned out that he had progressed from fatty liver to cirrhosis. So why is that? Does having a bad liver make your hands turn red? This is related to a hormone called estrogen. Not only women, but men also have a small amount of the female hormone estrogen. However, when the liver becomes damaged, it can't process estrogen, so the concentration of estrogen in the blood increases, causing the hands to turn red. The hands turn red. There are also other signs such as spider angiomas, where the blood vessels in the skin expand and look like spiders from a distance. Why does this happen? When estrogen increases, the hands and skin become red because estrogen causes the capillaries to expand. Capillaries under the skin of the hands and other areas expand due to estrogen, making them appear red. Focusing on the why makes learning more enjoyable and memorable. Here are 7 dangerous signs of liver dysfunction, with itching of the skin being the second one. When the liver is not functioning well, the skin becomes itchy. At first glance, this might not seem related. The reason is that when our blood is broken down, a substance called bilirubin is produced. This bilirubin is broken down in the liver and flows out as bile from the liver. It then joins the duodenum, which is just past the stomach, and is released into the body. When the liver malfunctions, it can't release metabolized bilirubin into the body. It starts to circulate in the bloodstream. The bilirubin travels throughout the body via the blood. This causes it to appear as itching of the skin. And as for other factors, actually the liver has a detoxifying function. The food we take in through our mouths and the substances produced by the metabolism of each individual cell, the liver has the role of detoxifying waste products. However, if the function of the liver declines, it can no longer detoxify these waste products. So toxins that cause itching accumulate in the body, leading to itchy skin. But doctor, my skin gets itchy. There are various conditions like allergies, eczema, and hives. So doesn't that mean it's not necessarily a liver problem? The key point is whether there are rashes or redness where it's itchy. If it's just persistently itchy without any rash or redness, consider the liver as a possible cause. Other causes of itching without bumps include similar symptoms can also appear with poor kidney function. If concerned about kidney-related symptoms, check the video link in the description. Dangerous signs of liver dysfunction. 7 signs. And the third one is this. Your skin turns yellow. Your stool is usually brown or yellowish. Do you know the reason why? To put it simply, without fear of misunderstanding. This color comes from bile produced in the liver being released inside. So if the liver is damaged and the bile produced in the liver isn't released, these components circulate in the blood, they accumulate in the skin and make the skin turn yellow. Do you know what this is called? This is called jaundice. I think many of you have heard of it. My skin is also on the yellow side, but it can become even more yellow, and the easiest way to notice it is by looking at the eyes. If the whites of your eyes are more yellow than usual, there's a high possibility of jaundice, so please keep that in mind. Please consider seeing a doctor at the hospital. Of course, jaundice is not caused only by the liver. If the flow of bile becomes poor, for example, if bile gets blocked around the kidneys, you can also develop jaundice. If a stone gets stuck in the bile duct, or if cancer forms and blocks the flow, jaundice can also occur. So jaundice can be caused by things like pancreatic cancer or bile duct cancer. Since it can often be a sign of a serious illness, I strongly recommend consulting a doctor if you have even the slightest suspicion. 7 dangerous signs that appear when your liver is not healthy. The 4th one is this: having bad breath. Everyone, have you ever heard of the smell of ammonia? Have you ever smelled that sharp, sour odor in a public restroom that hasn't been cleaned very well? That's the smell of ammonia. Actually, that's a smell that comes from urine, but when we normally urinate, it doesn't smell that strong, right? When urine is left as it is, bacteria break it down and produce ammonia, which is why it starts to smell bad. In other words, normally our bodies break down ammonia, and it's the liver that takes care of that. When we eat protein or when our muscles are broken down, ammonia is produced. The liver detoxifies this ammonia and turns it into something that can be excreted in our urine, so our urine doesn't smell that bad, and our bodies don't smell either. However, if the liver's function declines, it can't break down ammonia, so it circulates in the blood and can cause your breath to smell like ammonia. That's something that can happen. Not everyone with liver problems will have this smell on their breath, so please keep that in mind. However, if you've recently started to worry about bad breath, or if your family has told you that your breath smells, that could be a sign from your liver. Here is the 5th of 7 dangerous symptoms that appear when your liver is not doing well: feeling irritable or sleepy. Lately, if you've been feeling irritated or unusually sleepy and spaced out, those symptoms might be a sign from your liver. This symptom has the same cause as the bad breath I mentioned as the 4th symptom. Ammonia circulates throughout your body. This time, if it moves to your brain, it can cause consciousness disorders, making you feel spaced out or sleepy. If it gets even more severe, you could fall into a coma, which means you fall asleep and can't wake up. A characteristic physical symptom is asterixis, where a person's hands flap like wings even when told to hold them still. They start twitching their hands like that. It's also said that in the very early stages, personality changes can appear. For example, becoming more easily irritated lately, or feeling spaced out more often. Some people are described as becoming indifferent to everything, or developing a more childish personality. Lately, you might think, I'm just tired or stressed, and leave it at that. But if any of this sounds familiar, please consider consulting a doctor before ignoring it. Here is the 6th dangerous sign that appears when your liver is in bad condition: gaining weight. Can you really gain weight just because your liver is bad? Why does your weight increase? That's because your body starts to retain fluids and water. I've watched other YouTube channels, but some had incorrect information. When water builds up due to liver problems, it typically accumulates in the abdomen, ascites, rather than causing leg swelling. Lately, if you feel like only your stomach is getting bloated, even though you haven't been overeating or drinking excessively, that might be a sign from your liver. Swelling in the body can also happen due to kidney problems or malnutrition. In those cases, the swelling usually starts from the legs. That's because gravity pulls everything downward. That's why it's really difficult to bring the blood from the lowest part of the body back up. So when fluid builds up in the body, it usually starts accumulating in the legs. But the liver is different. Why is it that in the case of the liver, fluid tends to collect in the abdomen as ascites? If you think about how blood flows, you'll understand right away. Where does the blood that gathers in the liver come from? Actually, it's from what we take in through our mouths. Nutrients are absorbed in the small intestine and other places, but the nutrients and fluids absorbed in the small and large intestines first gather in the liver. Medically speaking, there's a blood vessel called the portal vein, and all kinds of nutrients first gather in the liver through it. But if the liver becomes unhealthy, it gets hard, right? When that happens, the blood flow in the liver also gets worse, causing a traffic jam of blood inside the body. When blood gets congested, some of it seeps out from the liver, and because of the congestion, the organs before the liver, like the small and large intestines, also experience blood congestion. As a result, the plasma, which is the clear liquid part of the blood, seeps out. So, because fluid seeps out from the liver, your abdomen becomes swollen and tight. What do you think? I believe it's interesting and easier to remember if you understand why this happens. Of course, when the liver's function declines, it can't produce nutrients, which can also cause swelling in your legs or arms. However, what's characteristic of the liver is that fluid tends to accumulate in the abdomen. Please use this as a reference. Here is the 7th dangerous sign that appears when your liver is not healthy. Overall fatigue. If you've been feeling unusually tired and fatigued lately, this could also be a sign from your liver. The liver is the organ that processes what we drink. It detoxifies things like alcohol and medication. Not only that, but it also processes the food we take in through our mouths. It also processes the metabolic products of every cell in the body. I explained that the liver also has the function of detoxifying waste products. So if the liver becomes damaged, those waste products start to accumulate throughout the body, which is said to cause general fatigue, or what we commonly call tiredness. Of course, tiredness can also be caused by things other than the liver, such as malignant tumors, so just thinking it's only fatigue and leaving it alone could be dangerous. And along with the liver, another organ that's just as important is the kidney, which I mentioned earlier. Everyone, you've probably heard the phrase kanjin before. That's right, the liver and the kidney, as the name suggests, they're both extremely important organs. In fact, when the kidneys become damaged, they can't eliminate waste products, which can also make your body feel sluggish. Other symptoms of kidney problems include anemia, reduced urine output, and more, which I've explained in previous videos, so please check the description box if you're interested. Now let's review one last time. Here are the dangerous signs that appear when your liver is in bad condition. First, I explained the redness of the hands, which occurs when the body can't metabolize estrogen, causing capillaries to expand. Second, there's itching of the skin due to bilirubin, produced from broken down red blood cells, circulating throughout the body when the liver can't eliminate it properly. This causes itching of the skin. Third, I explained jaundice, which is when the skin turns yellow. Check if the whites of your eyes are turning yellow. That's an important point. Fourth, bad breath. The liver normally detoxifies ammonia, but when it can't do that, an ammonia smell can come from your mouth. I also explained that. Fifth, I talked about symptoms like irritability and drowsiness. Ammonia circulates in the blood and moves to the brain. Due to this, you may feel irritable, spaced out, sleepy, or have a flapping hand tremor. In the worst case, you could fall into a coma and not wake up. That's what I explained. And the 6th point is gaining weight. I mentioned that ascites, which is water accumulating in the abdomen, can occur. Food we eat is absorbed in the intestines, circulates through the blood, and returns to the liver. If the liver stiffens, blood flow gets congested, causing fluid to seep out from the liver and intestines, leading to water accumulating in the abdomen and swelling. I explained that too. The 7th point is a general feeling of fatigue throughout the body. The liver detoxifies and eliminates all kinds of waste products from the body, so when it can't do that, you start to feel fatigue. And then, the kidneys are another vital organ that remove waste through urine. When they can't function properly, fatigue sets in. How was that explanation? This time I explained 7 dangerous signs that appear when your liver gets worse. I think the people watching this video are either very health conscious or maybe suffering from liver disease. These days, a lot of medical professionals and non-professionals are sharing videos, and many of them are very easy to understand. But sometimes what they say differs from video to video, and some can even be misleading. So, in this video, I broke down the medical knowledge to explain in an easy to understand way why these symptoms occur. I hope this helps you judge information for yourself and avoid being misled by incorrect information. I want to keep making videos that support your health in the future, so if you don't want to miss any new videos, I'd be happy if you could subscribe to the channel. Also, whether it's a thumbs up or a thumbs down, your feedback on this video will help me improve next time. And in the comments section, I'd be really glad if you could share your valuable experiences, like this is how my liver function was, or I was told I have fatty liver, or my condition improved after eating this kind of food. Well then, I'll see you in the next video.